Welcome to Real Life Women, for women, by women. Our mission is to impact and enrich lives by discussing anything that relates to our happiness, our health, and our wealth. Please take a moment to share, like, and subscribe to our channel so that we can spread the message of hope and perseverance and enrich lives together. Thanks for listening.
And welcome, everyone. My name is Tracy, and we have an amazing interview for you with Dr. Kristin Kidgell, the one and the only. She is the founder of Tailored Transformation. Kristin, how are you today?
I am wonderful, Tracy. Thanks for taking the time to do this.
It is an absolute pleasure. I love getting to know you more, and I just think you're an amazing person. So what I'd like to know, because you've recently released this Tailored Transformation, I'd like to know a little bit more about it. So can you speak on that, please?
Absolutely. Tailored transformation is basically filling a hole of allowing busy women to regain control of their health and their bodies again. So what I was noticing over the last 25 years now of practice and helping, not just women, but men and children and all these, different age groups is when our health kind of gets away from us, we have these moments of who do I turn to? What do I do? What tests do I need? And then what do I need to do to fix this? And do I want to go the medicine route? Have I waited too long and I don't have that choice? Or can I address things naturally? So obviously with my background in chiropractic, and then most people don't know this, but I've been using nutritional supplementation and muscle testing and things like that to identify not only what's wrong, but to know exactly what the body needs. And now with technology, I have been so honored to now have teamed up with an international company that does sensitivity testing. And these tests can be done from your home. And so they have allowed me to say, well, what do you want to test? And they have allowed me to create my own test for my clients. So
Wow.
I just turned 50. That's a big deal. And especially for women. And when we get into our mid 30s, and then we get into our 40s, and then we were starting to hit the 50s, our bodies are shifting and changing almost every 5 to 10 years very quickly, not like our male counterparts. And so because I've lived through those years and have helped so many women of all different, younger than me, the same age as me, older than me, all these different years, that I'm taking all that knowledge now in the technology of the testing and making it so easy to find out what are the root causes, what are our deficiencies, what are our imbalances, and then taking all the knowledge that how do we repair, how do we rebuild, and how do we rebalance that internal health. And what comes with that, we don't need a diet anymore. When internal balance is found, then your body's weight finds that balance also, and excess weight drops. So there's a lot more to it than that, but that's the tailored transformation. No test results are the same, no programs the same, but it's all there. It's all encompassing. It's a complete strategy for each individual.
So how does a woman know that she needs this? Is there, versus going to a doctor for whatever and searching down some other medical issue? How do they know?
Well, the women that I work with are typically very busy. Family, careers, probably trying to play sports, marathoners. What these women are noticing is their body is changing shape. It's not responding the way it used to, or they're holding the extra pounds. And sometimes with that, we don't put it together that our digestive system is giving us signs and symptoms. Or our skin is giving us signs and symptoms. Our hair is giving us signs and symptoms. And so when we start to notice these things, oh, my hair's thinning, or, you're noticing your skin is just different, then it's those people that are finding that curiosity. And then they're reaching out and saying, okay, I can do this naturally. I can repair, I can find these things out without having to go to the doctors and get lab tests and all that. Yeah, a lot of stuff has changed. Most of the women, though, that I get on the phone with and we start talking, and um, come on board are basically already kind of fed up with the medical route they've been going, and they're just one medicine, and then a few years later it's another medicine, and then they've done the hormone replacement therapies, and like nothing is working, even the thyroid medicines, and then they're on. I've heard a lot. I've heard a lot, and so they're looking for an answer. That's who I help.
Yeah, and it's extremely frustrating because a lot of the issues that us women face get brushed off as female issues, and
Right.
they're just left like that, and you're left feeling like you're holding the bag with no answers. So yeah, I get that. I guess, how exactly do you go through this program? Like, is it a course? Is it a one-on-one? Like, what are the steps?
There is a course and there is one-on-one. It's
Okay.
actually pretty involved, mostly because what we're used to is I have a symptom, here's a matching drug. I have a symptom, here's a matching herb. I have a symptom, I have a goal, here's this. But what ends up happening is we need to know what your body can and can't tolerate. And when we understand your biochemistry, then we can know exactly what you need. We know exactly what you don't need and exactly what you need. And when you don't know that, you're guessing.
Mm-hmm.
So we take the guesswork out. And then what that does is allows you to seek that internal and create that internal balance of health.
Mm-hmm.
So when your endocrine system is working together, with your digestive system that's working together, with your mind and your brain, and that would look like anxiety, depression, all these things where the mind isn't settled. And so looking at the body as a whole, body, mind, and spirit, then there's an entire holistic health that can happen for that individual. It's never
Mm-hmm.
too late. It's never too late.
And how long does it take, just to give people some expectations of actually figuring out a roadmap, and then from there, the time that they should start to expect some noticeable changes to see that this is working? How long does that typically take?
That is the gray area. That is so custom for the individual. If they're coming to me in their 30s and it's only been really developing for the last 10, 15 years, you have to remember, as women, our hormonal stuff really starts happening, really starts really affecting our lives in our teens, right?
Mm-hmm.
And in the teens, we it's pushed off. We are noticing problems then. And so in our 20s, we're still dealing with it. But then it really starts compounding. So the earlier we catch the problems and notice the imbalances and the sensitivities and the intolerances and addressing all of it as a whole, the turnaround can be fast. It can be weeks. Now, the testing needs to go off to the lab and we need to get those results back. That can take anywhere from 2 to 3 weeks. That doesn't,
Okay.
while we're doing that, the course is helping you with your mindset. And I'm there every step of the way, checking in with you, making sure the test, like, I'm getting these results back. We're setting up the time to go over them. And then as those changes are being instilled, if you have to make a dietary change, if you have to increase the calories and just increase moving, if you're sedentary and you start moving, I mean, some of this can unfold within weeks.
Mm-hmm.
Most of the programs, most of the biggest changes are when people commit to at least 4 months. At least four
Right.
months. Listen, diets don't work. They only really are working when you're on them. And this is not a diet. This is a life change. This is a body change. This is a mindset change. And
Mm-hmm.
that's who I help. Those people that are like, I'm done with this. I'm ready for that. And the more you put in, the more you get out, I guess is the best way to put it.
Yeah, for sure. And I'm pretty sure. I mean, you said earlier that you've heard it all, and I am a female, and I have a lot of female friends, and I've heard a lot of the same stories. I'm not a chiropractor, I'm not a doctor in any way, shape, or form, but when we get together, you hear the same complaints, you hear the same issues over and over again. Now, one of the things you said to me was that, you kind of, the people that you tend to deal with are busy career women, family, like they've got a lot on their plate. They're athletes, they've achieved some level of success in their life. But then I just heard you say that the earlier you can catch this, the better and the faster things can turn around. So really, basically, I just want to know is, what is the earliest that this could be beneficial? And do you have to wait until there's problems that start to surface, or can you use this as a preventative measure?
Before I answer that, let me say this. I picked a certain age group of busy career women because I am one. I decided to help those that I can fully relate to. Fully relate to this. Can I branch out and help children? 100%. If you have children, I will show you how to do it. Matter of fact, you can do it. Make it super, like the entire course is designed to give you all the tools to make the changes for yourself and then expand to help others. I'm going to give you an example of a couple things because my daughter was 12 when we started finding out everything with her, and it was life-changing for her. Literally life-changing for her. Whole nother story. But when patients come in and I have a kind of a family practice, and they know that I do nutrition, they know I do the emotion code. So, I have this label of chiropractor, but I'm so much more. I am a holistic doctor and just constantly studying like hormones and things like that. Now, I have seen children coming in here, and I'm talking the age of 2 and 3, where the mother is telling me that their son is having these skin issues. And so I'm like, okay, well, here's the perfect example of how these symptoms can show up young. Belly aches, nauseousness, bloating, but a lot of skin issues are seen in like 3, 4, 5-year-olds, 6-year-olds, 7-year-olds because of what they're eating, what they're being exposed to. And when they get this testing and then they see the results and then they make the changes around that, mm-hmm. that is where the changes start happening and caught early.
Okay, so again, these are symptomatic individuals. So if somebody isn't symptomatic and they just want to guide their children in living a healthy lifestyle, or they want to live a healthy lifestyle, is this something that could help them identify potential problems in the future, or will it only work if you're symptomatic?
That's another good question. This is basically like a fingerprint. This can tell you a lot about yourself and 100% tell you should not be eating this. This is affecting you. And a lot of our symptoms are from buildup of time. So you might be symptomatic now, but the problem started 5 years ago. So it's very preventative.
Okay, great. Then, yeah, I guess another question that I have for you then is accessibility. You live in the United States. Is this accessible to anybody outside of outside of the United States, basically?
The company that I teamed up with works internationally with, I think it's growing, but I know of at least 5 or 6 countries. Australia, Canada, definitely.
Okay. That's great to know.
The UK.
And then, awesome. And then what I'd like to know as well is, what are some of the biggest obstacles that our listeners right now might be thinking or feeling that prevent them from taking that next step and calling you?
Procrastination.
Okay.
Fear of change. And sometimes they give up themselves for others. And that's not a bad thing because they're mothers, their wives, their sisters, their daughters. And if you're taking care of an elderly parent or you've got 5 kids, putting yourself on the back burner is one of the other biggest obstacles. So those are really honestly the things that can easily be overcome, but that's why I do it as a coaching program, because I'm the biggest cheerleader for each one of these women. I want to outcare everybody in the room and in their family right now about what's going on with them. And so be there for them.
Mm-hmm. So what are some of the tips that you could offer that could help people take that next step?
Write down a couple things you really want to accomplish in the next 6 months to a year. What do you really want your health to look like? And then ask yourself, well, if you keep doing what you're doing now, what will your health look like? So if you have some goals, and you know that you want to reach them, then you need to come up with your why. Like, why even bother?
Mm-hmm.
Why do you want to make these changes?
Mm-hmm.
So when you have that mindset, are you ready to get better? Are you ready to create health? Those are the stepping stones to change.
Okay. It's a great tip. Love it. You mentioned that a lot of the clientele is women, and we've talked a lot about women. I am curious to know whether or not this can help men. And do you work with men? Will you work with men?
I do help men identify, I mean, really the testing and the protocols and the strategies and just the whole design of it all absolutely can work with men. But my course and everything is specifically written for the woman. You know, it's just an identifiable
Yep.
situation. Um,
Yep.
Talking to a guy about their health issues, I'm not a guy. Sometimes there's a disconnect, but
Yep.
usually when I'm working with a guy, they already have known me somehow. They've seeked maybe the emotion code from me. Okay, that's
Right.
common. Or they've come into the chiropractic realm, or they've had an injury. And then maybe we get down and we start talking about the topic of the testing and the supplementation. It's typically a different route. I can't identify with the busy dad who's
Mm-hmm.
like, they don't have the hormonal issues. They
Yep. Yep.
do. They're just different. Can we still address them
Right.
and help them? Absolutely. But it's
Yep.
usually the husband of a wife that I've helped, or the
I gotcha.
boyfriend. Okay.
Yeah, I gotcha. Totally.
Anybody
All right.
can,
Well,
anybody that's a human being can get help.
I appreciate that. Now, do you have any like 15-minute consultations or free consultations, anything like that? Or how do people, what's the next step?
What we found that works the best is about a 45-minute call. Now, do all the calls last 45 minutes? No. But when we really start talking about our health and our lives, it usually takes anywhere from 15 to 30 minutes. And if there's some Q&A afterwards, most people still have a lot of questions, then we have that padding there to make sure that the call is, when they get off the call, like, they have so much data and
Mhm.
direction and a strategy of where are they headed next? What are their next steps?
Perfect. And what do people do? Where do they go right now if they want to find more information and get connected with you?
Yes. So my website, which is www.drkidgell.com, there is a tab that says coaching at the top. And if you click that, there's a little bit about me. And at the bottom of that little bit about me in the program, there is a button that says, book a call.
Perfect. And we'll throw the links in the description below, right? So people can find that information in the video description. So that's excellent. Kristin, once again, it's always a pleasure interviewing you. It's always a pleasure talking to you. You're a wealth of knowledge. And I just want to know right now, is there something that you can tell the audience or share with the audience that maybe somebody doesn't know? Maybe people don't know about you?
Little fun facts.
Yeah, little fun facts about yourself, about Kristin.
Fun facts. Well, this program came out of a need. That's an interesting fact, because people are like, well, what would the need be? The need was giving this advice, helping these people, giving them, here, go do this, and here, go do that, and here, go do this, and they wouldn't follow through, and they would
Mhm.
be upset. And so the only way to help people follow through is to hold their hand. Number one. Number
Mhm.
two, another fun fact is that I've been doing this for about 25 years now. So that's kind of a long time.
Yeah.
Another fun fact would be, I've written a couple books. One's about CBD oil, and another one's about the foster care system.
Mhm.
No, I'm not bashing it. I'm just helping people push through it.
Yep.
And that second one is not fully released yet, but it is done. One of the other things that people will find out about me if they're playing in my website is that you and I have something in common. We both love trading, and we have a podcast together
We do.
where we
Yes.
read books on wealth and health and mindset. And so we've been doing that a couple of years now. And
Yep.
then during COVID, I was kind of bored and started a YouTube channel called Real Life Women, where I just interview women from so many backgrounds, and it's just those are just fun. That's like a passion project. That's just fun. So yeah, those
But
are
a
a lot
wealth
of
of
little things.
knowledge.
Huh?
It's a wealth of knowledge, though. You have some pretty amazing guests that come onto your show.
That
So
is true.
yeah,
I've been super blessed
yeah,
for that. And I
yeah.
really do. It is such a joy. I'm so glad I started it because I do get to interview some really, really amazing women. But yeah, those are little big fun facts.
Well, there you have it. Like I said, you're an amazing woman, but that's exactly
Thank
why,
you.
you relate to the busy, successful woman, because that's exactly who you are. And it's in a plethora of genres and areas that you just overwhelm the industry. So I love it. People reach out to Kristin. I guarantee she's got a heart of gold and is willing to step through fire to achieve your goals, as long as you're there to go with it. She can't drag you, but she can definitely walk with you. So, uh,
The
yeah.
dragging's painful.
Anyway, yeah, exactly. So, thank you once again, Kristin. I greatly appreciate you joining me today, and hopefully, we get a chance to chit chat again very soon.
Thank you,
All
Tracy
right.
Ball. You're awesome.
Take care. Bye.